Good evening, everyone. I'm Dr. Jajuan Johnson, the Mellon Foundation Postdoctoral Fellow. Great to see everybody this afternoon for our final panel session. Um, Thanks for those who decide to stick around and join us. We also have people on Zoom whom we would like to greet as well. I'm joined by three other panelists, actually, Dr. Daniel Driffin, who's with me here, and we also have two virtually, Dr. Kyle Fox, as well as Mr. Robert Suttle. And before we get started, I wanted to actually provide some context for this panel, Healing Ourselves, Black LGBTQ plus community making in the eras of HIV/AIDS and COVID-19, a panel commemorating Dr. Johnny Baily. Black LGBTQ plus people make indelible contributions to the liberatory and healing work of African and African descendant people, despite marginalization within and outside our communities. Laying bare these narratives was part of the personal and scholarly mission of my friend and brother, Dr. Johnny Baily, who left life too soon. And on December the 25th, 2022, at the age of 37, silence surrounds his tragic death that occurred in the city of Philadelphia. But I and others will not be silent about his legacy as an intellect and lover of humanity. Dr. Baily, a native of Lynchburg, Virginia, earned a bachelor's degree in history from Virginia State University, a master's degree in history from the University of Cincinnati, and a Ph.D. in history from Morgan State University. Johnny was a postdoctoral fellow at Rutgers University and taught at Montclair State University, and considered himself a son and student of John Coltrane. In my time of knowing him, he demonstrated a firm conviction about the value of Black lives because of the isolation he endured for living boldly as a Black gay man. He believed that healing happens in the context of community. And we're here at this panel this weekend because we too understand that salvation occurs in the context of community, as was once stated by Bell Hooks. Although I and many others carry the sorrow of Johnny's physical absence, we celebrate his brilliance. I gained healing from the stanza in the poem, When My Brother Fell, by the late poet, gay activist Essex Hemphill. When my brother fell, I picked up his weapons. I didn't question whether I could aim or be as precise as he. This panel draws inspiration from Johnny's manuscript, as proud of our gayness as we are our Blackness. The political and social development of African-American LGBTQ plus community in Baltimore and Washington, D.C., 1975 to 1991. Through an analysis of the National Coalition of Black Gays and Lesbians, formerly the Coalition of Black Gays, Johnny endeavored to uncover the stories of individuals in the Black gay community who played a crucial role in the fight for gay rights by reconceptualizing the boundaries between racial and sexual identity. Through the development of a Black gay identity, a community took shape that struggled against racism, anti-gayness, poverty, food insecurity, racial violence, discriminatory laws, and public policies and health disparities. Ultimately, his study highlights the complexities of the LGBTQ plus communities and the changing terrain of African-American social movements in the post-civil rights era by examining how Black LGBTQ plus people articulated and currently voice an agenda for social justice and healing. The session will discuss the ways Black LGBTQ plus people draw on the histories of their own to tackle persisting inequities, healing ourselves. The panelists and I stand on the shoulders of many who, out of their vulnerability, build generative possibilities for community care and survival, as stated by Professor Kathy Cohen in her 2022 Ryerson Lecture, Democratic Futures, Race, Resistance, and Political Vulnerabilities. A few of these earliest organizations that probably inspired the work undertaken by myself and the panelists are the Committee of Black Gay Men, organized in 1979 to combat negative stereotypes of Black gay identity, and the Literary Circle Other Countries, established in 1982 to tell the stories of the Black gay experience. Their early literary projects were supported by Kitchen Table Women of Color Press, founded by poetess Audre Lorde, because the telling and preserving of authentic narratives are a healing balm. Other organizations that developed in the 1980s and early 1990s were Gay Men of African Descent in New York, Adodi International in Philadelphia, Brother to Brother, San Francisco, Black Men's Exchange, located in multiple cities, NAESM in Atlanta, and the Brothers and Sisters Incorporated of Little Rock, Arkansas. Early organizations set a precedent for recent advocacy groups, such as the Chicago Black Gay Men's Caucus, Thrive SS in Atlanta, which you'll hear more about in a moment, Impulse Group, the Arkansas Black Gay Men's Forum based in Little Rock, Arkansas, established by me in 2019. Also, the National Black Gay Men's Advocacy Group. The existence of these groups affirms that Black LGBTQ plus people are not passive bystanders amidst the uncertainties and traumas of epidemics and pandemics. Still, we press through fear, denial, physical limitations to heal our communities and other marginalized groups. Today, I have the pleasure of being joined again by Dr. Daniel Driffin, Dr. Kyle Fox, and Mr. Robert Suttle. Each of them is profoundly changing the world on public policy, public health, and academic landscapes, particularly as it pertains to the well-being of Black LGBTQ plus people. They will share their story and their work and issue a call to action, because in the words of Mrs. Fannie Lou Hamer, we want a change now. I will briefly introduce our panelists in the order they will present, and then we'll move to their presentations. To the left is Dr. Daniel Driffin. He is the project manager and works in external relations for the COVID-19 Prevention Network and HIV vaccine trials with the Fred Hutchinson Cancer Center. Dr. Driffin has worked at the intersection of advocacy and assisting communities impacted by HIV for the past decade in Atlanta, Georgia. Daniel is the creator of and senior advisor to D3 Consulting LLC. The consulting firm assists small to mid-sized community-based organizations, health departments, and other programs aligned with engaging men of color within healthcare settings, not limited to HIV prevention, research, and treatment, but also within systems providing increased health literacy and culturally connected services. Dr. Kyle Fox is the assistant professor of communication at the College of Coastal Georgia. His research focuses on the construction and performance of gender and race identities, specifically Black masculinity. He completed the study on the emergence of Black gay farmers, an overlooked population, overlooked group who contributes to food production. He is also involved with the preservation of Gullah Geechee heritage on the coast of Georgia. He earned a Ph.D. in humanities with a concentration in African American studies from Clark Atlanta University. And last but not least, we have Mr. Robert Suttle, who is a New York-based advocacy consultant and movement leader in the global HIV community. He has expertise in decriminalization, human rights, and the intersection between equity and social justice. For over 10 years, he has cultivated relationships with other cross-movement leaders, advocated for meaningful involvement of communities most impacted, centering Black communities and communities of color, and connecting advocacy to decriminalize HIV to other movements around prisons, policing, and criminalization. He is the former assistant director of the Zero Project, a US-based network of people living with HIV advocating for the end of HIV criminalization. Without further ado, we will move forward with our first presenter, Dr. Daniel Driffin.
Good afternoon. Now, come on. Come on. Let's try it again. I'm like, from far, far away land. And hello, Zoomers. I have to begin with, it gives me great pleasure to be here with you all today. I personally did not know Dr. Johnny Baily, but I do personally know the story of so many of our same gender loving brothers who are not currently on this land with us, and oftentimes taken entirely too soon. I have to mention Dr. Johnson opening the presentation with powerful words by Essex Hemphill connected to When My Brother Fell. It really doesn't go unnoticed to me, especially since when we created the organization known as Thrive Support Services, we really centered much of our earliest work connected to Essex Hemphill for My Protection. And that poem specifically starts, I want to save my life. If Chrysler, Nixon, Wells can be saved, certainly the lives of Black men are priceless and worth saving. And I think oftentimes when I think of the many intersectional pieces of me, I think of the different solutions being birthed from those corners. I look forward to hearing more about Dr. Fox's work, and it gives me great pleasure also to be sharing virtual space with Robert. Robert and I have been traveling together over the last couple of years, but we literally have like been in the same place for the last 2 weeks in a row. So though he's not here in person, I'm happy he's online with us. So this is really, a snapshot of some of the discussions that we will be discussing. My first picture is my grandfather and I. My grandfather was born and raised in a small town, small county in South Carolina known as Williamsburg County. If you've ever heard of the big town called Greeleyville, okay, that's where my people's from. So the Gullah Geechee bloodline runs deep through me. I'll talk about this next post as we continue the discussion, and it truly sparked our initial conversations around what would be known as Thrive Support Services. I'm a nerd by training, so I love research. I love talking about research. I even love like watching odd documentaries, and ultimately somehow that sparked my interest for public speaking. I remember I have a picture on my office wall of my third grade report card, and it says, Daniel makes great grades. However, he's a little too social. Little do Miss Melville know, it would help me in these platforms. And finally, most recently, just completed my degree this past December from Georgia State University. Thank you, thank you. So I think of my organizing truly like maybe 3 or 4 different buckets. Um, if you know me outside of the work that I do, I love food, I love to travel, I love an old fashioned, and I love just sitting talking to people. And that really led me to like my first big activities after moving from South Carolina post undergrad to Georgia. Myself and a friend of mine, Justice Smith, we created Brothers Who Brunch. This is a snapshot of some of those Brothers Who brunches. So between the years of 2013 and 2019, more than 700 Black same-gender loving men convened at my house. We had a rotating Sunday brunch. We invited folks, anyone on the street. So it's Taco Tuesday. We're sitting at, a restaurant. We see someone Black. They somehow start talking about Beyonce or Rihanna. We're like, oh, you should come to Brothers Who Brunch. Over the years, 700 people came through my house. We asked folks to either bring champagne or bring a dish to pass. Some days I think we only had maybe some bacon, some eggs, maybe 4 pieces of French toast, but we had like more than 8 boxes of champagne. Little to say, the conversation went from roughly 11:30 a.m. I remember one night, like the last person walked out of my living room at like 10 o'clock at night. And I'm like, Jesus, y'all, like go home, go home. But it truly showed me the power of community building. Our discussions span the gamut of life. I cannot recall the number of times folks, once walking in said this is the first time of them sitting together with other Black gay men and talking about life. So often there's just not many brave spaces where Black and brown queer people can put their heads together and freely talk about life, talk about what it's like staying in a loving family, what it's like having to create a chosen family, and all of these things are important when we think about community building, building power and brotherhood. Again, everything that I do at some point in time is going to touch a Black gay man, specifically Essex Hemphill, Marlon Riggs, Joseph Bean, Asante Saint. So, from the initial conversations, these books would always be around, while we're having brunch, so folks can truly thumb through and see the power that flows through all of us. I think one of my favorite quotes is attributed to a an enslaved person named Terence during the Roman Empire. And it's in Latin. I'll give you the English version because I'm not that good in Latin. But it says, "Nothing human can be alien to me. Nothing human can be alien to me." So if a human has done it in the past, I, in my community, hold the exact same characteristics and capabilities to do it. So having these ancestors in our realm only promoted us. Um, this bottom picture is a thank you note from a friend of mine reminding me to take my meds. So I've been living with HIV since 2008. And my advocacy connected to HIV is truly, what sparked my public health interest and everything else moving forward. So another big movement that I had the extreme pleasure of being a part of is known as the Young Black Gay Men's Leadership Initiative. If you know anyone in public health, we use acronyms. So this acronym is YBGLI. Okay, it just flows off the tongue, doesn't it? I know. Over 6 years, the National Black Gay Men's Advocacy Coalition, again mentioned by Dr. Johnson, it's just the woven web, I think, amongst the community that is ever important. So NBGMAC called 5 young Black gay men and said, "You guys should do something." We're like, "What do you mean you guys should do something?" We organized specifically after reading the CDC results. And it showed a 48% increase, a 48% increase among new HIV diagnosis between the years 2006 and 2009, specifically for African American men who have sex with men. So imagine if at your table, there's 10 people sitting at your table. Literally between 3 years, every year it was 5 new folks diagnosed. When you look at any other population, there's never that high of a percentage increase. And that really sparked our interest in not only creating a conversation, but sustaining the conversation. So we wanted to create a cadre, a group of young Black gay men centered on community mobilization, research policy, leadership development, and communication. Um, our earliest conversation started in October 2011, and we hosted a quick webinar. Again, no, I'm sorry, 2011, that we didn't have the word webinar yet. That was a conference call. That was on 1-800 conference call, thinking about it. 100 people signed up to be on the conference line. 100 people signed up to be on the conference line. And, sitting on that conference line, hearing the doo-doo, 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 that was the sound when people like came onto the conference. Zoom has nothing on conferenceline.com. But anyway, hearing those doo-doos truly showed not only did we have a motivated group, but we had to do more. So that really led us to our first in-person meeting around what should this convening be like? We invited 10 folks to come to DC. We put our heads together and we created an initiative. In January 2012, again, at one of those organizations that Dr. Johnson mentioned, NAESM, N-A-E-S-M. NAESM stands for the National African American Education and Services for Minorities Incorporated, a group created by Black gay men and Black trans-identified women in Atlanta, Georgia, aimed at reducing HIV also. We had our first in-person conversation leading to our Policy and Advocacy Summit. Between the years of 2012 through 2016, we invited anywhere from 55 to 75 young Black gay men from around the nation to come and learn about HIV and how can they go back into their own communities and change it. We even hosted the first Twitter town hall. We invited individuals from our federal government, specifically the Health and Human Services Administration and the Director of the Office of National AIDS Policy, which sits in the White House. Terrible picture. Again, we didn't have 100,000 megapixel cameras back then, but let me see if this video will play. Oh, thank you, Mr. PowerPoint.
This conference is the Young Black Gay Men's Leadership Initiative Policy and Advocacy Summit, and it's important because it is the first of its kind convening of young Black gay men, convening for young Black gay men to talk about issues and solutions for addressing the HIV/AIDS epidemic, as well as quality of life for other young Black gay men under the age of 30.
New HIV infections, increase access to care, and improving healthcare outcomes for people living with HIV, and finally, reduce HIV-related disparities and health inequities. And there you see all the action steps. That was what our current president said back in 2010.
Yeah, this is a collective of about 50 young Black gay men. So this has been the third convening of it. Just really just a wrap up to the summit and really talking about the intersection of working for Black gay men and living as a Black gay man and making sure that you do the work, but you also take care of yourself and rely on the different generations of Black gay men here to be leaders and mentors and even family in this work and in our lives. For more information, you can go to the National Black Gay Men's Advocacy Coalition's website at www.nbgmac.org or the Young Black Gay Men's Leadership Initiative website at www.ybgli.org.
That's me in the yellow pants. I love those yellow pants. So damn COVID. Oh, I don't know if I should curse that here. Okay, let's see. Next slide. Okay. So again, this is just a really quick snapshot of some of the impact. And again, like this was the first time young Black gay men put their heads together to bring other young Black gay men together to teach and to go back and do something differently in your hometown. You know, I think of some of the young people who are still my friends, truly like friends and family members now. We invited a guy named Marvell L. Terry II from Memphis, Tennessee, to our first summit in 2012. By the time he was back in Memphis, okay, he was organizing what is to became the Red Door Foundation. The Red Door Foundation has had 8 summits since 2012, known as Saving Ourselves Symposiums. Again, very similar, bring people, teach them, let them go back and, you know, truly change America, change their communities. And this is just some additional pictures of the group. So this truly led me to creating an organization. Again, when I think of that powerful poem from Essex Hemphill, I wanted to start an organization to save my life. Thrive actually stands for Transforming HIV Resentments into Victories Everlasting Support Services. So in our name itself, it's a love letter back to Black gay men impacted by HIV. The three of us, myself, Larry Walker, and Doreen Bridges, put our heads together back in April 2014 to really create a non-traditional support system for Black gay men living with HIV. We use something known as Judy support. I know you're probably like, what the heck is Judy support? But literally, it's that bond between your good girlfriend, your Judy, okay, for you to just like motivate each other. And motivating each other for us specifically looked at medical adherence or taking our medication the way that it's prescribed. We instantly, as we started having these conversations, we again created non-traditional ways to remind folks to take pills. We did something really early on called #PillCheck, and it would randomly just take like the most odd picture on the internet, tag it pill check, have you taken your pills today, right? So you can have a picture of, someone sitting on the beach, pill check. You can have a picture like the one I showed you with the pill sitting on, the post-it note, pill check. Again, it began the conversation of changing social norms when we think about living and thriving with HIV. Our earliest days was truly around reaching and maintaining viral suppression. And viral suppression, as people living with HIV, if you take medication as prescribed, you should reach what is called undetectable. Once you are undetectable or the amount of HIV is in your blood so low, you cannot spread it, you cannot transmit it during condomless sex. That's known as undetectable equals untransmittable, U equals U. So we wanted to highlight that amongst men who look like us, who live in the same neighborhoods like us, because when we look at the data, one out of every two Black gay men have not achieved viral suppression. When we look compared to white gay men, okay, more than 75% of white gay men who are living with HIV have achieved and maintained viral suppression. So again, disparities instantly. Those intersections of our lives have created solutions. Again, we wanted to truly think about how do we have different conversations around disclosing HIV, and I'll talk about that on the next slide. We wanted to solve social determinants of health that negatively impact HIV. So housing, employment, insurance, transportation. If you do not have a way to get to and from your doctor's appointment, you're less likely being healthy. So again, we wanted to think of the most holistic way forward in creating community change for people impacted by HIV. Instantly, we took this moniker of doing nonprofit differently. And these are some of the big programs that have sparked since we've been around. This first picture is known as the Silver Lining Project. It's a network inside of our overall network of Black gay men living with HIV all above the age of 50. We have more than 200 folks connected to our Silver Lining Project. Our Silver Lining Project is now in its second iteration of a 5-year grant from a pharmaceutical company providing resources. Next picture is Lotus. Again, a network, a niche network specifically for cisgender women living with and thriving with HIV. Over some more, Thrive Toastmasters. Have you heard of Toastmasters USA? Like the people that go around and talk? Obviously, we like to talk, so we wanted to teach other people how to talk, right? So we have an official Toastmaster chapter inside of our organization. Underneath, Project Griot. Griot is an African term of storytelling. We wrote a grant a few years back, before COVID, so everything's like 10 years now, specifically to put together a documentary of 5 Black gay men living with HIV in the most impacted cities. That grant ultimately turned into a $200,000 project where we've made close to 4 films now at that intersection of people impacted and living and thriving with HIV. And you can see many of the project reels on YouTube. Project Innovate. Again, thinking of those social determinants that impact health, we created an economic engine inside of the organization. So we received roughly $75,000 from a company to create small pilot projects for young people living with HIV who can start their own businesses. Businesses include popcorn making, candle making, a young person with a t-shirt line that like grosses more than $400,000 now on Instagram. So again, like thinking of holistic answers for people thriving with HIV. And finally, the last picture is a snapshot from our I Thrive campaign. And traditionally speaking, we would go into our physician's office and not see pictures on the walls, not see pictures in magazines that look like us. Have you ever experienced that? Like you're in the blackest or brownest part of your city, in the magazine in your clinical room is like the complete opposite. So folks would always say, well, we don't know where to find people to. So we created a project, we took the pictures and we did it. This last thing, social norms, changing social norms. We started a conversation around, so every person living with HIV find out they're positive someday, right? My day is June 19, 2008. I walked in, got tested, and learned I was positive. I remember being isolated, being scared, and thinking that no one, would ever like rally around me again. Rather than sitting in that dark place, we created something different. We monikered it as a seroversary. Again, we started having parties on our seroversaries amongst our group. The Independent, it's a newspaper in the United Kingdom, traveled across the ocean to Atlanta to see how did we do this, okay? And they followed us for a week. And this is the article, recapturing, reclaiming what it means to be living with HIV. And these are just some pictures of my specific journey as I've lived with HIV over the years. This first picture is sitting around a table with other Black gay men. And I randomly, popped my pill one day and they was like, oh, let me take my medication. And before we did that, we put all of our pills in our hand and take a picture. This was in 2019. In 2022, this middle picture, I made the transition from taking a daily pill to remain healthiest with HIV to taking no pills. I take an injection treatment every 60 days. I've been on injectable treatment for 2 years now, the healthiest that I can be thriving with HIV. And again, when we truly think about the trajectory from day one, folks taking 20 pills multiple times a day to living in a place where you do not have to take any pills and still can be healthy. This is what power looks like. Again, I leave you with embrace the fear. This is one of those, this is a stat, I live on Facebook. This is my status on my seroversary back in 2015. And I thought I was actually inside of our private closed Facebook group sharing this. And I said, today, 7 years ago, I found out that I tested positive in Columbia, South Carolina. I can clearly remember the initial thoughts of me not being able to do many things. I thought no one would ever want me again. Little did I know the milkshake still bring the boys to the yard. I leave you with embrace the fear, change the world. Thank you.
Thank you so much, Dr. Daniel Black. Those powerful words. Dr. Daniel, yeah, I'm thinking of He lives in my head too. through his literary work, Dr. Daniel Driffin. Dr. Daniel Black may be watching, who knows? But for those powerful words on community, the power of what happens when we come to the table. And we'll talk a bit more about that. But next, we have Dr. Kyle Fox, who's going to join us via Zoom.
Hello.
Oh,
Is it loud? Can you hear me?
we can hear you.
Oh, perfect. And Dr. Daniel Black does say hello, Jajuan. I told him that I was speaking. I was speaking with you this morning. All right. So thank you all for having me. I am joining you from the coast of Georgia. I've entitled my talk today, "More Than a Living Room, a Space Where Community Gathers." From the Stonewall movement of 1969 to the AIDS epidemic of the 1980s and COVID-19 of 2020, members of the LGBTQ community, especially Blacks, has faced tremendous hurdles in the legal, political, and healthcare sphere. Like other populations, the Black LGBTQ population has been characterized by and named by significant events. For example, the Stonewall generation, the AIDS generation, and the cyber queer, or I say queer, generation. Although naming indicates a shared historical and cultural perspective, historically, these dominant white spaces, legal, political, and healthcare spaces, have not only marginalized Black LGBTQ populations, but effectively silenced them. This is also the case with the larger white LGBTQ community and Black hetero spaces. However, in doing so, this marginalization has strengthened Black LGBTQ social power in regard to community building. The marginalization by whites, as well as Blacks, has forced this community to build and define family on its own. You all may be familiar with the seminal documentary, Paris is Burning, or the more recent, heavily inspired by the former, FX series, Pose. In each, we see the concept of community and family taking shape in the ballroom community during the AIDS generation. In gender racial realness, theorizing the gender system in ballroom culture, Marlon Baily extensively employs ballroom culture to examine gender, performance, and community building. In a much more extensive work on Black gender performance and ballroom culture entitled Butch Queens Up in Pumps, Gender Performance and Ballroom Culture in Detroit, Baily examines the gender categories that exist in the ballroom community, specifically the Butch Queen category. As with any gender identity, the gender categories of the ballroom have a particular script and practice. Baily argues that the ballroom is a site where individuals attempt to achieve realness, which refers to the successful minimization or elimination of any sign or of deviation from gender and sexuality norms in heteronormative society. Realness is not simply mimicking heteronormative gender norms and performances. Rather, realness serves as a measure and a guide for understanding the strategic gender performance that members deploy in the urban spaces in which they live and move daily. Realness is the measure of how one proves that he or she can perform a particular gender expression in the real world. This piece will make sense very soon. While the ballroom offers a liberative space for nonconformists, it is also a space that engenders a shared cultural bond, hence my reference of the living room. The ballroom then becomes a safe space for one to become themselves and form relationships. There are several theoretical perspectives that informs this presentation. However, that is not what I am here to do today. This presentation is not about autoethnography, gender performance, or the like. It is essentially sharing one's pathway to belonging. This is the story of 5 strangers meeting under the strangest circumstance and forming an invaluable connection. Moving to Savannah during the tail end of the COVID-19 pandemic, I had no family nor friends in the area. I knew no one. Like anyone new to a city, you think it will be difficult to make friends. But this was during a global pandemic, and it was going to be extremely difficult. This was in a pandemic where everyday interaction was a hodgepodge of Zoom calls and awkwardly socially distanced interactions through masks and the lingering smell of disinfectant. So, where does one go to make friends? Of course, the hub of Black social, financial, and political life. Of course, it's the church. We all needed salvation during that time. It was quite uncertain if we were going to make it to the next day. My pastor in Atlanta advised me to join his childhood church in Savannah, and I did, only to discover that not only did I join the oldest AME church in the state, St. Philip AME, which was established in 1865, many think is Big Bethel in Atlanta. However, they were not affiliated with the denomination until 1866. But the congregation was also aging, and they were attempting to reach younger parishioners. Having joined, I did get a sense of community, but much more was lacking. So then I thought to myself, where does a young, attractive, professional, Black gay man go to find similar gay friends in the midst of a pandemic? Duh, Jacked and Grinder. For those of you who are not familiar, they are akin to the break room at your job. I kid, they are networking sites and you can use them however you please. I don't judge. After chatting with the guy for a few hours, he invited me out for a platonic social drink that was socially distanced. It was a great time, and it was the beginning of a great friendship. A couple of weeks later, he invited me to his house for a game night, and there I would meet the other members of Noah's Ark. We called ourselves that because we shared similarities and occupations of the characters in that series. Myself, the professor, Alan, the HIV/AIDS testing center director advocate, Joel, the artistic museum director, Justin, the construction engineer, and Jonathan, a healthcare worker and a hospital executive. We would come to form this community that kept each of us sane. But because this panel is about honoring the legacy of those we deem important and who have come between us paving the path of community, I wanted to highlight this group of men or give them their flowers, so to speak. So I asked them a few probing questions. The first I asked, and you will hear what they said. During the time in Savannah, outside of our core group, did you find it difficult to establish meaningful relationships with other LGBTQ people? Alan says yes and no. I kind of gathered this, but I also had a few meaningful connections with the LGBTQ plus population in the region because of the work that I do. It wasn't easy at all, but I also wouldn't call it difficult. My struggle was being sociable because of my anxiety. Jonathan says, professionally, yes. I had an incident in which I went on a date with someone who worked in healthcare, and my business was shared to the staff following our date. With Savannah being so small, I decided that a professional LGBTQ group would be unlikely. However, I did meet someone on the apps, and that led me to finding a group that I would hang out with regularly. However, that group I found lacked diversity, but you have to survive. I did develop a few long-lasting friends from that group. Then Justin says, I did. Coming from a majority Black gay friend group in my hometown, it was hard finding that here in Savannah, and the non-Black Latino gay population I met triggered microaggressions in me. The second question, what did our group dynamic relationship provide you that other spaces did not. Alan says, it gave a space for me to be a bit more authentic. I was genuinely not performing with you guys. I don't have to do that. I can just be me, and that is so refreshing. Jonathan goes on to say, people that looked like me and were going through the same experiences living in a city that lacked Black LGBTQ professionals. I was able to escape and feel like I didn't have to be on all the time. I was able to be myself and express myself without judgment. Justin says, Black as hell, and we all had similar trajectories, but different personalities and backgrounds. And it was a group of young Black professionals in different fields that helped me navigate my first salaried job in a corporate environment. The third question, do you feel establishing a group like ours was beneficial during your time in Savannah? Why or why not? Alan says, yes, I absolutely do. I was slowly recovering from a broken heart, and our group gave me a place to breathe and laugh. Each of you loved and appreciated me in a different way. I didn't know I needed it, but looking back, you all helped me to stay sane. Jonathan says it was completely beneficial. It felt just like waiting to exhale. Justin then says, I think so. We talk about building community and being intentional about friendships. And I think that's what that was. We were able to bring in other people and have gatherings where we connected both socially and professionally. And the final question, what was your fondest memory of our time together? Alan says, playing Uno at Justin's apartment and watching Kyle and Justin seethe. It was everything I needed that night. A close second, almost tie, would be our last gathering at Jonathan's place before we began to separate geographically. Jonathan says, the potlucks and cooking for you guys. There was a straight couple that tried my pound cake and her husband couldn't stop talking about it at Alan's place, or the shade we throw at each other when talking about our favorite artists. And Justin says, game night for sure. Also going bowling and the Joel shenanigans. Also disassociating when we would play Uno. So as you can see there's always some drama with Joel and Uno. But from the testimonies, community building and bonding is essential for our survival. We heard in those responses things like it kept us sane, and it truly did. Now, the reason you did not hear Joel's voice is because Joel and my schedules did not match. He was busy with a new job, another Joel shenanigan. And a take on my favorite quote from Junior LaBeija in Paris is Burning. When you have friends and community that has become family, it is OPULENCE. You own everything. Thank you.
All right, thank you. Thank you, Dr. Fox, for those powerful words on the ways that marginalization can lead to us discovering our own power. We're going to revisit that in our quick Q&A, but we have Mr. Robert Suttle, who is next, last but definitely not least. And then we're going to have some time for Q&A from our guests who are on Zoom, as well as those who are present with us. There you are.
Oh, good afternoon, everyone, or wherever you might be today. Apologies that I cannot be there in person, but I'm glad to have 15 minutes of your time to share with you what I will talk about today. I think I'm taking a little different perspective when I think about healing ourselves, Black LGBTQ community making. I feel like I've been in community making for a decade now, particularly as someone who didn't necessarily had a lot of experience being around other LGBTQ people, mainly probably because I didn't know myself well enough. But for the past decade, I've had the greatest pleasure of being able to be a part of community, but also do important work within my community, and important work that I consider to be healing in itself. It was definitely healing for me. And the reason I say that is because I am a person living with HIV, been living with HIV for 20 years. And unfortunately, in the state of Louisiana, I experienced what we call HIV criminalization. And so I had never known anyone living with HIV. I had never known anyone to experience HIV criminalization. So for me, these were new first experiences that I've had to endure. And so I consider my work really to be quite healing, in that I bring healing to myself, as well as trying to bring healing to our community, as our community has been impacted by the epidemic of AIDS, and continuing to be impacted by HIV today. And so I'm just going to share a few slides. Won't be too long, but I want to start with a few takeaways from Dr. Baily, and who we are honoring in terms of their work. And let's see. Okay, I think I'm there. All right, so from the chapter 5 in Epidemic, We Cannot Afford to Ignore, Pioneering Early AIDS Activism and Education. And so this chapter resonates with me because it's, it talks about how Black gay men were important actors in the early years of activism. The chapter argues that Black men were the first to expand the concept of AIDS as more than a sexual issue. They articulate that it was also a disease shaped by political and racial atmosphere of the country. And these are things that are experiencing that today. This position drove them to establish their own organizations to deal with the rising number of infections in their communities. This chapter highlights how the Black gay community, primarily Black gay men, made significant inroads, influencing both the growing AIDS bureaucracy and the Black community to recognize AIDS disproportionately how it impacted people of color. And last, they spread awareness and education and spearheaded several initiatives, such as organizing the first conference that dealt explicitly with AIDS in the Black community. And so these takeaways resonate with me because these are things that I had experienced in my activism and my advocacy. You have to understand, I was someone who wasn't sure what he was going to do after I was released from prison. I ended up serving 6 months in prison, and also had to register as a sex offender. And so if you know anything about the South, here I was a Black man, Black gay man living with HIV, now formerly incarcerated person with a felony, and also having to register as a sex offender. And so I have dedicated my life to speak on behalf of this because of the perception that people have about gay people, about Black people, about folks living with HIV, about people who have criminal records. And I felt that it was very necessary for me to speak up and use my voice to speak on behalf of those who wouldn't otherwise be able to articulate their experiences. And we as Black folks, we all know that we have our experience, but there's some of us that have other experiences that, they quite intersect because we don't live single issue lives. It was very important that I speak out to try to set the record straight. And as I said, I've tried to spend the past decade doing that. And here's my most recent event that I spoke at with the Native Son at a Black Gay Leadership Forum. And this article headline is really something I wrote recently for our HIV is Not a Crime Awareness Day, which I will highlight a little bit of that later. I encourage you, those of you that are interested, you can read this, What I Wish I Had Known About HIV Criminalization. And so I wanted to highlight a few trends because I think it's important for people to understand why we cannot forget, why we can't ignore this epidemic, as Dr. Baily had mentioned in the manuscript. While HIV may no longer be a death sentence, it's still a prison sentence. These are lesser known felony laws that are enacted in the late 80s and early 90s, punitive laws and policies that single out people living with HIV based on their status, the inappropriate use of the criminal law to regulate and punish people living with HIV. And believe it or not, these laws do not require criminal intent, no consideration of science, meaning the HIV science as we know today. Even use of safer sex practice or having undetectable viral load is not considered a defense. And so knowing this is so important because Dr. Driffin mentioned about 1 in 2 Black gay men contracting HIV. So you have that. And then also 1 in 3 Black men will experience incarceration in their lives. And so if you put those both phenomenons together, they create this perfect storm of HIV criminalization. And then, of course, there are new threats now that are out there regarding upgrades to certain penalties for assaulting law enforcement officers and requires offender to be tested for communicable disease in certain instances. And so there are some dangers out there that are happening to vulnerable people, vulnerable populations, my people, our people. And that's why I found that this issue is so important to uplift. Because as we try to heal from our experiences around HIV/AIDS, there is still other things that are happening out there that will disrupt our healing. And we have to do all that we can to address those issues that prevent us as a community from healing. And I just wanted to provide this map for those of you that are totally unaware of this issue of what HIV criminalization looks like in the United States. And please pay attention to the law, the states in the South, how the dark red represents states with HIV-specific criminal laws. And I am from the South, I'm from Louisiana, and we know that the epidemic is so prevalent in the South. And we know that a lot of Black gay men and women live in the South. And so if you just look at that overlay there of what we know about the South, how prevalent the epidemic is there, as well as the criminalization laws, as you see in the dark red, those states that have HIV-specific criminal laws. People also can be prosecuted under general criminal laws using HIV as the aggravating factor. And then there's also states that have sentencing enhancements. And so if you are a sex worker, injecting drug user, or whatever other identities that you may carry, and you happen to be living with HIV, then your sentence can be enhanced simply because of your status. So some of those consequences that I feel that I've learned the hard way that our community will experience is felony convictions, lengthy prison sentence, sex offender registry, which myself had to be required to register for 15 years in the state of Louisiana. And would you not believe they also put sex offender on your driver's license there. It's no longer required on the driver's license, I think as of 2021, due to the Supreme Court ruling there in the state. So, but it's still, they're still required to register there. So this issue has done more harm than good when it comes to public health and safety. Believe it or not, there's no evidence, there's no research to indicate that HIV criminalization actually reduces transmissions. And again, this impacts our community, Black, Indigenous, people of color, LGBTQ community, as well as people with disabilities, no and low income people, as well as those people who are immigrants from other countries. It's an issue that just has such a range and depth that it impacts our communities who already have fraught relationships, whether in the medical public health field or within with law enforcement. So I see this as another way to prosecute Black people, again, people who are marginalized. And so, and also understand that incarcerating people for HIV-related charges has cost states millions of dollars. And just imagine that what we could do with those millions that we're using to continue to prosecute people and incarcerate them, that those funds can be used to enhance services around public health, as well as mental health services, so on and so forth. So there's a way forward. Again, a lot of this represents the communities the broader communities that I've been a part of to address this issue of HIV criminalization. So there are initiatives that are for modernization of laws and criminal penalties for people living with HIV. We just recently celebrated or acknowledged our third year of HIV is Not a Crime Awareness Day, which occurs every February 28th now. For the first 2 years, it was just the US Awareness Day, and now it is a global Awareness Day. And so I'm really proud of the progress that we've made to, because HIV criminalization is not just something that happens in the US. The US definitely leads in the prosecutions, but it is a phenomenon that happens all around the world. And in terms of community, there have been some examples. We've hosted our first, not our first, we had the inaugural of the HIV is Not a Crime Training Academy in 2014. And so we're now at our 6th installment of the HIV is Not a Crime Training Academy. And that is all from community. The organization that I've co-founded, the Suttle Project, back in 2012, led the charge with initiating that first conference that spoke specifically to HIV criminalization, but now has broadened. The organizing partners have broadened to include a representation of all communities that are impacted by it. We also have the Black United Leadership Initiative, which actually started out as an institute at the HIV is Not a Crime Academy, and now is continuing as an initiative where Black folks living with HIV and working in this community can come together and organize and find ways to end the criminalization of Black people. And I encourage you all to take a picture of this page because, for those of you that may want to follow some of these initiatives, there's also the QR code down at the bottom there on the right for those that may be interested in joining the Baily initiative. As well as there's HIV Justice Academy there for people who are interested in learning about this issue that would want to be a part of it. There's the Elizabeth Taylor AIDS Foundation, as well as the Health Not Prisons Collective, which is our longtime collaborators who represent communities that are impacted by HIV. And so there's about 5 organizations there that from Transgender Law Center, the Suttle Project, the Positive Women's Network, Counter Narrative Project, as well as, I'm leaving out one, I think it's, I'm leaving out one, but that's most of them. And so I wanted to offer that, I share with you the trends, I share with you some consequences that, based on the enforcement of criminalization, and these are the things that impact our community, but there's also a way forward. And I think from the activism, those early years of activism have really provided a blueprint, at least in my eyes, they provided a blueprint for me as to how I needed to engage and get involved. And again, I think it's something, this is such a pressing issue even now because not many people know about it, but we have made great strides with it. And there have been several states that have been able to modernize their law, as well as one state recently that repealed their law in the state of Illinois. And so there's still work to do. We would like total repeal, but we have to go for modernization in terms of it reflecting the science of what we know today, knowing that people who are on treatment cannot transmit the virus to other people. However, has not stopped law enforcement from arresting people due to misunderstanding or not enough knowledge about how HIV actually is transmitted. And so I encourage you all to learn more about it so that you can share with your communities, as well as the communities, if you know people who are connected to communities that I've highlighted today. And so I thank you for your time. And I also have one more slide for those that are wondering what you can do. And so the goal will be to help build a future where HIV is addressed through public health and not imprisonment. And so, again, this is a few links that I would encourage people to follow if they're interested in learning more about this issue. And do please feel free to reach out to me as well. Thank you.
Thank you so much, Robert Suttle, for those powerful words. We can't extend healing to others until we go within and begin to heal ourselves. And through that, we can do the transformative work that you and many others are doing. We're at the Q&A portion. And we want to open it up for those who are here, those who are online, who are watching via Zoom. I also want to make note that this panel is being recorded and will be available in the coming weeks. If you would like to share it, take in this information and pass it along to others.
So you were talking about the states that that say HIV is an aggravating factor and that they don't prosecute HIV specific laws, but there are non-specific laws that use HIV as an aggravating factor. And I saw Virginia was one of them. It was the orange one on that map. And I was just kind of curious, what does that mean? Like, can you give an example of where HIV is an aggravating factor, but you're not being prosecuted specifically for it?
Oh, I apologize. I think you might have misunderstood me. There are states with HIV specific laws that prosecute people simply because they're HIV positive. Louisiana was one of those states. Virginia, it was a state that did a bit of modernization, and forgive me, there's so many states I can't keep up with which state did what. But if the state does not have an HIV specific law, then they can prosecute people under a general criminal law. For example, if you are a sex worker working in Virginia, and Virginia has laws that is against prostitution, well, they may take you in, they may arrest you for prostitution. And for some reason, I think they may have other laws that may require that people who are being charged with prostitution to be tested against their will, in my opinion, to be tested for HIV. And if they happen to be test positive for HIV, then they're going to also have either additional charges or a greater sentence enhancement. So hopefully that clears that up. But
So-
thank you for your question.
When HIV is the aggravating factor.
Yes.
Okay, that makes sense. Thank you.
Yes.
And recently, I think within the past 2-3 years, Virginia modernized its laws. It's not to the extent that advocates want, but I don't know the exact changes, but you can definitely Google that. But there was some augmentations made to the law in Virginia the past 2 or 3 years. 2021.
Correct.
We have a question
Hi,
here.
thank you all for speaking. It's been amazing, incredibly informative. I have a question, I think specifically for Dr. Driffin, though, if anybody else, and maybe Mr. Suttle, if people want to weigh in. I'm curious as to how, what role doctors and medical professionals and scientists play in community forming and supporting Black gay men who are HIV positive in a country that has a history of exploiting Black people through the Tuskegee experiments, with Henrietta Lacks, with, as we were learning about earlier, the East Marshall Street Well Project. How do doctors, do they play a good role in this? Is there kind of a discrepancy there? Is there pushback? I'm just curious about more the medical side of things.
How much time do you have?
We have 10.
Oh, okay, only 10 minutes. Okay, so high level, absolutely. I think first it starts with diversity, right? So we have more than enough data that shows when Black gay men have Black physicians, Black medical providers, they just go the extra distance. You know, as we think about treatment notions and moving down south. So like Robert was saying, those perfect storms in public health world or even, you know, science world is this term called syndemics. Syndemics are multiple aggravating systems impacting individuals and groups, right? So we see that half of the people with HIV live in the South. We see more than half of Black people live in the South, right? You have 10 states who have yet to expand Medicaid. Those 10 states are in the South, okay? So that's that piece, right? We see we've only known that if you prescribe HIV medication to people living with HIV since 2012, if they achieve undetectable, they will not transmit HIV. We see lower rates of prescriptions to antiretroviral therapy, the HIV medications, to Black people in the South. flipped the script and talked about preventing HIV. So there's drugs known as pre-exposure prophylaxis. You could take a daily pill, or you could take a monthly or bi-monthly shot. Medical providers are less likely to prescribe PrEP to Black people. Medical providers are less likely to provide PrEP to Black gay men. More times than not, they say rather than taking PrEP, you should limit the number of people you have sex with or use condoms, right? I mean, it goes like even the next step forward with insurance providers. Your insurance companies can outright deny prevention tools for large groups of people, not because they don't work, but because of the cost, you know? So it's a multiplying effect for sure.
Any other questions?
I have a question for Dr. Fox.
Go ahead.
Hey, Dr. Fox, can you hear me? Okay.
Yes.
You made mention of Uno during the pandemic. So can you guys put draw twos on draw twos? Or can you put a draw four on a draw two? Because we have a debate in my friendship circle, and we say you have to match the card. What say you?
You could put draw twos on draw fours and all of the craziness, and it sparked a lot of debate and animosity between the group.
Thank you. Thank you.
Well, I have one final question, and I pose this question when I've been in groups with Black gay men, but it's the completion of an I statement. I envision a world where Black LGBTQ plus people are. We'll start with you, Daniel.
I envision a world where Black gay men are truly able to see the power that flows through us. Yes, the power that flows through us. There's no movement you can name that did not benefit from a Black gay man or a Black queer person. So I want us to realize the power that we hold inside. The universe made us a little bit different.
Thank you. Kyle Fox.
I envision a world where Black gay men are free from the constraints of family, societal expectations, and self-doubt, and live their authentic selves.
Robert Suttle.
Ooh, I envision a world where Black gay men, Black gay men particularly, are not seen as criminals simply for existing. And also I envision a world where Black gay men's stories will be captured in all sorts of ways that that we will never be invisible, we would never be ignored, we would never be, again, viewed as criminals, but that our stories will resonate forever for those that, you know, outlive us.
And that concludes our panel. Thank you so much.